Hey, Dr. Lucas Marchand, the house call chiropractor here in Sioux Falls, and we're going to talk about chiropractic and stroke risk. In clinical practice since 2015, graduated in the fall of 2014, and I've been in private practice working for myself since 2016. A really emotional topic, even for chiropractors, because I am not going to propose here in this video that there's zero risk and shouldn't worry about it. That's not what I'm going to say. But we need to have a more balanced approach to how we approach any medical intervention, including chiropractic. Two of the symptoms, at least, are neck pain and headaches, and millions of people every day have neck pain and headaches, and it's not practical to do advanced imaging studies on every single person that comes in with a headache. Scott Haldeman proposed that the actual events compared to malpractice cases with chiropractors causing a stroke is something to the tune of one incident to every 6 million adjustments. Now, that being said, here's the caveat against that is how many adjustments are happening every day? Probably millions. There's probably 70,000 chiropractors around the country, and they're all adjusting them in some sort of way. Now, not all of these adjustments are towards the neck. Some of them are towards the thoracic spine. Some of them are for the shoulders or the kind of extremity adjusting or the low back. So take that with a grain of salt. Now, the funny thing is, well, I shouldn't say funny, but cervical artery dissections typically are happening usually in kind of a younger to middle-aged population. So I'd say 28, 25, maybe 30 to 50. That's kind of a pretty broad range. And the funny thing about that particular demographic, in my instance, is when we're in chiropractic school, that's kind of the range of students. And we're all, learning, trying to hone our skills, to put it nicely, and practicing on each other multiple times a day. So the highest risk demographic getting treated by the least skilled chiropractors or soon-to-be chiropractors. If it was, a risk, you would definitely see more incidents coming out of the chiropractic colleges. But I think we do need to take a more balanced approach to this. Just like anesthesia, people, unfortunately, they pass away during other procedures, including taking anesthesia for a surgery, for example. But that doesn't mean we need to get rid of all anesthesia. Of course we need anesthesia. For example, if someone's coming with back pain or even upper back pain, I don't touch their neck. If you go to a barber and they're rinsing your hair and you're rotating, it's that extension and rotation of the neck. Going on a roller coaster, going to a trampoline park, doing yoga, bending in weird positions, swimming, vomiting, that Valsalva maneuver, coughing, lifting heavy objects where you have to really bear down. Those things can cause a stroke. So again, I'm not saying be dismissive and cavalier. I'm just saying I don't think we really know what causes it, other than some people, their arterial walls are just, whatever, predisposed to just kind of loosening up, and then you have an embolism, and then da-da-da-da. As humans, we always have to have a cause and effect with everything, and sometimes, at least at this point, we don't know exactly the mechanism. So I hope that helps. I hope that makes sense, and I'll see you in the next video. Have a great day. Bye.